The project that we're working on here in Western Kenya is an opportunity to look into the global AIDS problem and particularly the response from the Kenyan government and from the world community.
It was very scary. Very, very scary for Kenyans. People started really dying very young and very early. The initial response was denial, no, it doesn't exist, no, not us, and no, not here. It was a taboo to have HIV, it was a curse. Around about 2001, Cambridge started collaborating with Boston University.
In that time when treatment was just becoming available, it wasn't clear who was going to pay for it. So we had a financial argument that we were trying to make. Don't run away from the HIV/AIDS epidemic, invest in the HIV/AIDS epidemic. Think of it as an investment opportunity with positive returns. The positive return is a healthy labor force that would help your business continue to succeed.
That can be translated into policy and improve the quality of life of the people. This is the job that we are doing with Boston University.
For the past 10 years, we've been working here in Kericho. We're trying to estimate what the productivity effects of the disease are on agricultural estate workers, in this case, tea pluckers.
This is a production field for tea.
Tea is the main cash crop in this region, not just in Kericho, but in Kenya.
The tea plantations are massive, many, many square kilometers of land. Thousands of workers work on the plantation. HIV prevalence within the plantation community was 9–10% prevalence, 11% perhaps in women, 12% even.
Now we chose the tea estates for a particular reason, and that was we needed a workforce where we could directly measure productivity. As you can see, each one of these fields is clearly demarcated, and each one of these workers is an individual producer.
Each person picks the best 2.5 leaves. This is what we take to the factory to be processed for pluck tea.
The wage of the worker is directly related to how many of these leaf buds that they pluck.
If somebody plucks 10 kilos, he's paid for 10 kilos. If he plucks 100 kilos, he's paid for 100 kilos.
These are the check roll registers where they would keep the records of how many kilograms of tea the pluckers were plucking on a daily basis.
We record each and every activity on every day.
This is an incredibly unique opportunity to actually look at changes in productivity over time, not just the number of days somebody doesn't show up at work, but the number of days that somebody shows up and they can't do as much as they could have done had they not been sick.
With the advent of treatment, we were very interested in, could you build a financial case for the tea estate firms that they should actually invest themselves in the production of a healthy workforce. These companies had a legitimate interest in posing the question, why should I be doing this? And what does it bring for me as a firm? So we quickly started a second study. What are the productivity impacts on the workforce of being able to receive antiretroviral therapy? There were deep debates within the group. What if our data showed that in fact investments by the firms would not be beneficial? And would we be providing a legitimation for withdrawal of service? And after very heated debates, these are not easy decisions, I'm very proud of where we as a group ended up. And most simply put, we ended up with let the data speak. I think the commitment of our group is to provide applied research, to provide empiricism that helps people make thoughtful decisions. Might they be different than what my own heart might wish? Certainly, I think that's a fear, but I think the role of a university research group is to produce the evidence and then to disseminate it and let the chips fall where they may.
For this new study, we wanted to actually follow people and look at their productivity 2 years before they went on ARVs and 2 years after.
What we've shown in this second study is that you can catch workers, you can remove the mortality experience, which is the profoundly important piece. These tea pluckers who used to die now no longer die of this disease. And what we showed was that the rate of recovery is very high, but there's about a 2-month lag before you begin to see the labor productivity recover, and then it's a very rapid rise.
In 6 months, they were catching up with the other workers.
Here we are with real data saying that somebody improves and can actually get back to as productive as any other person in the labor force. I think these results will really motivate employers to take care of somebody who's not well, because actually this person who you've invested so much training on treating them, there's actually a chance of them maintaining their productivity. I'm glad that someday in the future, this work will be able to help somebody make a decision that will impact somebody's health.
As a university research group, all of us are committed to the core mission of public health, which is to improve the health of populations around the world.
There's a large, massive international effort to fund the access to antiretroviral therapy.
I think we'd all like to live in a world where everybody did the right thing at the right time for the right reasons. But we live in a world where there are pressures on governments and pressures on private sector firms to do what's in their either national interest or their financial interest. Part of our mission as an applied research group is to take our research and put it in the language that the audience can hear.
Look at what we have done with Boston University. We are showing that if you treat your people, they will live longer, they produce better results for you, they'll be more productive, and it's less expensive to do that.
These tea fields are beautiful, but these tea fields are also brutal. This is very hard work, and in that way we believe that the labor demand of the tea industry is similar to most agriculture throughout Africa, and therefore we believe these findings in the tea estates of Western Kenya could contribute to both national knowledge and global knowledge on the impact of HIV and HIV treatment on labor productivity. We'll tell the story in the tea estates of Kenya, but I think the message will be heard much more broadly.
There's a friend of mine who has had HIV for a while, and before treatment, he did not think that he'll have to plan for his retirement. And came ARVs, and now he's 55, and he's just actually having to plan for his retirement.
And what I would hope is that our research begins to construct an evidence base that governments and firms around the world can use to make the case for investing in treatment, in keeping their labor forces as healthy as possible, keeping those household incomes going, and in that way, through employment in addition to health, help mitigate the impacts of this global pandemic.